the new med student.
Hi, my name is Michael Walls. I'm a fourth-year medical student at Touro University in California, USA. I'm also the president-elect of the American Medical Student Association.
Hello, my name is Vishal Shah. I'm the National Medical Director's Clinical Fellow to the Royal College of Ophthalmologists. I'm also a representative on the Ophthalmologists in Training group, and I'm a Specialty Registrar in Ophthalmology based in London.
Hello, my name is Lily. I'm a medical student at the University of Bristol, currently intercalating. I'm also on the committee for the Bristol Women in Surgery Society, and I'm Assets, Equality and Diversity Ambassador Group Lead.
Hi, I'm Michael Okocha. I'm a General Surgery Registrar in the Southwest, and I'm the Association of Surgeons in Training Equality and Diversity Officer. I really hope you enjoy this episode of 50 Faces of Surgery. I hope that it leaves you feeling valued, inspired, and most importantly, welcome. Here I am.
Yet, here you are. There is no doubt that almost every doctor, surgeon, and medical student worldwide has watched Dr. Flannery, also known as Dr. Glaucomflecken. Dr. Flannery is an ophthalmologist, comedian, writer, and viral TikTok star based in Oregon, USA, where he lives with his wife and 2 children. Originally from Texas, Dr. Flannery completed his undergraduate studies at Texas Tech University, medical school at Dartmouth College, and residency at the University of Iowa. Mixing medical education with comedy, he now has over 1.2 million followers on TikTok and 46 million views. He has served as editor-in-chief of iRounds and has published in both the Ophthalmologist and British Medical Journal, and in 2020 was named one of Portland's top doctors by Portland Monthly magazine. Alongside his comedy in ophthalmology, Dr. Flannery has raised tens of thousands of dollars for First Descents, a charity that provides free outdoor adventures for young adults impacted by cancer and other serious health conditions. Welcome, and thank you so much for joining us.
Thank you so much for having me. I'm excited to be here.
So the first question is, can you take us through your morning routine?
Well, first of all, fortunately, I'm an ophthalmologist, and so I don't have to get up too early, but I wake up and take the dog out and get the kids ready for school. So I'm making lunches, making breakfast. I'm more of a morning person compared to my wife, and so I got a lot of duties I take care of in the morning. Because I'm the one that can function the best at like 6:30, 7 in the morning. And then I'm off to work. If it's a clinic day, I leave the house, go to clinic, get started there around 8 o'clock. If it's a surgery day, I'm in the OR by 7:30 doing cataracts. And then just working until a much needed lunch break. That's how the morning goes.
Great. And then can you tell us about your childhood and what life was like growing up?
So I grew up outside of Houston, and my mom was a middle school teacher. So she taught 6th grade, and she actually taught me. I was her student, which was a horrible idea looking back on it. My dad was an aerospace engineer. They're both retired now. And so he is very much an engineering personality, which is something I make fun of from time to time on social media. And I grew up. I have an older sister and a younger brother, and so I was just kind of classic middle child, just kind of at times kind of forgotten. Kind of got to really do whatever I wanted. Not a lot of I had a few rules that I had to follow, but I was kind of off on my own a lot, which was great. I really loved that. played a lot of sports growing up. Yeah, I've really had a very nice, very wonderful childhood, and and eventually I got turned on to medicine, which I'm sure we'll talk about.
Yeah, so the next question is, why did you apply for medicine?
I've always been interested in science, and you know, I got exposed to science a lot from my dad's side, you know, as a as being in aerospace, but the engineering didn't really excite me so much, but I loved biology, and I love dissecting things, and so I I started thinking about, you know, what I wanted to do in a science career, and I actually did a summer camp where you go and you is looking back on it, it's really quite lame that I was like in sixth grade. I was like, let me do a science camp where I go hang out with med students and doctors. Like, what is that? But that's just ridiculous. And so you know, so I did that, and I loved it. And at that point I thought, okay, maybe I want to maybe I should go to med school. Maybe this is for me. And it just kind of, it just stayed in the back of my mind. And then as I, you know, got through high school and into college, I just went on the pre-med track and kept at it.
So how did you find medical school? What was it like for you?
I I loved it. It was really hard. You know, I didn't have it as hard as, you know, some of my classmates who didn't come from a medicine background. I feel like, or sorry, a science background. I feel like it's probably a little bit harder of a transition for some of my classmates. It was really difficult, but I just really enjoyed it. I remember just having a lot of fun, enjoying the classes, learning the science, everything except for metabolism, which is awful, and biochem. No, thank you. None of that. But all the physiology, all the anatomy, I loved it. I loved it. I had a little bit of exposure to it already in college, and so some of it, you know, was a little bit, you know, I was able to grasp it a bit quicker. But it was a lot of work, but a lot of fun. And I was at Dartmouth for med school, so it was called Dartmouth Med School at that point. And it changed we changed our name halfway through to Geisel School of Medicine at Dartmouth, because Theodore Geisel, Dr. Seuss, you may have heard of Dr. Seuss, their family donated about $200 million to the school to get their name put on the name of Dartmouth Med School. And it was a big deal at the time, because the administration told us, please don't refer to this school as the Dr. Seuss School of Medicine, which of course we did, like every single chance we got. We were the first, I was the first graduating class of the Dr. Seuss School of Medicine. But it was a small class. We had like maybe 70, 75 students. And I really loved having that small, tight-knit group. We all knew each other. We all hung out. It was a great time.
So after Dartmouth or Dr. Seuss School, where did you go for the rest of your training?
So I went to Resurrection Medical Center, which is in Chicago, Illinois, for my intern year, which was a transitional year where I barely learned anything. There's a reason that program has been has changed to make it a little bit harder, because when I went there, it was almost a vacation for an entire year. But you know what? I was going into ophthalmology. What do I need body medicine for? And so I did learn a few things. I had a few tough months there. I did. ICU, critical care medicine was I had to do a couple months of that. That was a harrowing experience. But after intern year, I went to, I'm sorry, everybody, if you hear my dog barking in the background. After my intern year, I went to the University of Iowa, and where I did my ophthalmology residency, and loved it. Just had unbelievable training, just a great experience, wonderful co-residents and attendings. And then at the end of residency, I decided that I was done with training. I had to go get a job and do something and make some money. And so I forewent any kind of fellowship and got a job out here in Portland.
And would you be able to tell us a bit about what your first week as an ophthalmologist was like for you?
My first week out of training. Yeah, I was excusing myself from exam rooms to go look stuff up a lot. I remember that. It's, I actually don't, I kind of remember my first patient, but it's such a whirlwind because you're running a clinic, for the first time. You're constantly thinking about your upcoming first OR day where you're going to be operating by yourself for the first time. And so it's just a lot of kind of surviving, feeling like you're trying to survive that first week, which we all do. We always survive, and you make it through, and the next week's a little bit easier. But that first week, yeah, I probably seemed a little stressed, I would say, if you were to ask my staff.
And finally, how did you get into social media?
Well, I was at a research ophthalmology conference, which sounds as exciting as you would think it is. So I am not a research person. I loathe doing research. Even looking at an Excel spreadsheet makes me want to throw up a little bit. Okay, I'm just not a research person. That's fine. I'm glad other people love research. We need people that do research. It's just not going to be me. But I found myself in residency at a research conference, and I was bored out of my mind. And so I was like, what am I going to do? And one of my co-residents suggested that I join Twitter because he knew I had a background in stand-up comedy. I'd been doing stand-up, on and off since high school. And he was like, this is perfect because you can tell your jokes on social media. It's great. You have an audience. So I started it and I was pretty much hooked. And I got on Twitter and started telling jokes to like 3 ophthalmologists who were also at that conference, probably also equally bored. And then it just kind of gradually grew over time. And that was about 5 years ago now. So it's definitely grown.
What challenges have you faced along your journey?
Oh boy, where do I start? Most of it, it's pretty much all been health challenges for me, for the most part. When I was a 3rd-year med student, I was diagnosed with testicular cancer, and my wife and I had a kid at that time. So navigating that, fortunately, as a lot of people know, testicular cancer is eminently treatable if you catch it early. And I did. So I caught it, got treated, was able to graduate med school on time, went on to residency. And then at the beginning of my last year of residency, I had testicular cancer in my other testicle. I'm really good at finding testicular cancer, like really good at it. But that second time was a little bit more difficult because I was trying to find a job. I needed to graduate. We had 2 kids at that point. And then now I have to decide, are we done having kids? Do I bank sperm? What is hormone replacement therapy going to be like for me? How expensive is all this? All these things that I had to try to figure out while I was also trying to finish training. And it was just, it was a very stressful time. But we got through it. Everything went fine. I was able to graduate on time from residency, get a job, a really good job that I'm still at today. This is the same job I got after residency. And then in 2020, the last thing, the biggest obstacle was my cardiac arrest. As if 2 times having cancer is not enough, I decided to have a cardiac arrest. And so and that's been, people have seen that journey that I've been talking about a lot on social media and following that along. And my wife saved my life performing 10 minutes of CPR And it's been a slow recovery. Physically, I'm fine. My heart's fine. Got a defibrillator in place. The emotional recovery has been longer, and it's still ongoing, but I'm doing okay.
So thank you for that. And I know you've done a lot of work to kind of raise awareness for testicular cancer and also making sure people are aware of how to do CPR. Um, and you spoke about the charity that really supported you through that. Is there anything you wanted to talk about from that
Yeah.
perspective?
Yeah, I've been whenever when you're diagnosed with cancer in your 20s, or really when you have any kind of health problem in your 20s, you know, the rug gets kind of pulled out from under you, because when you're young like that, you feel invincible. You feel like you could do anything, and nothing will hurt you. And then you have a diagnosis like that, and it just gets taken away from you just like that. And all of a sudden you find yourself sitting in waiting rooms with people who are 3 times your age. And you just have this feeling like, what is going on? And you don't see anybody around you that looks like you, that's as young as you. And and so my wife actually is the one that found First Descent, which is an organization based out of Denver, Colorado. And it's just an organization that brings young adults impacted by cancer together to really form a support network. But it's also about allowing you to trust your body again, allowing you to recognize that you can still do a lot. And even though you have this diagnosis that's affected you physically, mentally, and emotionally, you can still do everything that you put your mind to. And and the way they do that is by bringing a group of young adults together to do kayaking, mountain climbing, surfing, all kinds of things. And it's just an unbelievable supportive experience. And after it really changed me, and it gave me that support network that I desperately needed at that time in my life. And so since then, I've just been trying to use my platform on social media to give back to that organization, which has given me so much.
Thank you. And I know you've raised money for them, you've done a lot of work for them, and I'm sure they appreciate it, and I'm sure you appreciate them.
Happy to do it.
So that brings me to my last question. In your career, has there been a moment, maybe it was, you were standing alone in a theater doing the cataracts on your own for the first time, or maybe you just saw someone poking an eye, and that for some bizarre reason inspired you to do ophthalmology? Has there been a career kind of changing moment for you?
I guess there were 2 moments when I knew I wanted to do ophthalmology. All right, the first one was it was my first day watching surgery in the OR, watching cataract surgeries, because I had just come off of vascular surgery. I had just done like 7 weeks of vascular surgery, where you're standing, sometimes wearing lead for like 6-7 hours. You're just standing there motionless, wondering when this will end. You're rounding at 5 o'clock in the morning. All the attendings are wearing compression stockings because they stand for so much of their life. They're standing up. And then I got to ophthalmology, and people sat down. They were sitting while in the clinic. They were sitting in the operating room. They were taking lunch breaks. They were going to their kids' whatever. I was like, "Ooh, this is," and you get to do surgery. There's a surgery thing you can do, because I knew I liked surgery. There's a surgery thing you can do, and you don't have to worry about venous insufficiency. It was just a totally, and it was like, that was the rotation I did right after vascular surgery. So I was like, oh, I like this. And then one of the attendings let me put a suture on the conjunctiva to close after a retina case. So I was like under the microscope. I was putting a suture, through the conjunctiva, which is not a big deal, but it was a huge deal to me as a med student. to be able to do that in the operating room. And I was sold. That was it for me.
You a fool's gold. Yes, I did. Yet, here you are.
Dr. Flannery, thank you so much for your really insightful answers so far. This leads us towards the end of the interview. So if you could go back in time, what would you say to inspire or motivate yourself?
I would say, don't worry about getting a bad grade. Like, and one thing I've learned, not only just through my own medical education, but also I do a lot of cameos for people. So I record videos I can't tell you how many pep talks I've given. People are asking for a pep talk for med students and residents. Part of it's probably just because of the pandemic, but also just because medical education is hard. And it's so easy to get bogged down in some of the little things, right? Like you have a test on cardiovascular physiology and you don't do well. And it kind of wrecks you for like a week. And you feel like you can't do this. You can't succeed in medicine. And sometimes that's all it takes, because we're all wired that way. We are all very motivated people and very ambitious people. And a lot of times, a lot of us kind of breeze through college and high school, and all of a sudden we get to med school, and where we face a little adversity. And I've been there, and I guess that's what I would tell myself, is that don't sweat the small stuff, honestly, and realize that one or two bad grades on a test on the Krebs cycle is not going to make or break your medical career.
And the next question kind of builds on that, really. It's, generally speaking, would you have any advice for kind of aspiring medical students, aspiring surgeons, and indeed aspiring ophthalmologists?
Yeah. Don't lose the things that you love to do outside of medicine, because medicine can so easily and quickly take over your life. It can be all that you're about if you let it. And it's so important to remember the hobbies and the activities, the things you love to do that have nothing to do with medicine, because we all need time where we're not thinking about patients, or we're not thinking about the different types of EKG abnormalities that we have to remember, and just stuff like that. And so by having whatever it is that you do outside of medicine, to have that you could turn to when you need a mental break, when you need to just get away from the field of medicine, because we all need to do that every so often. For me, it was comedy. And there were times when I stepped away from comedy. I wasn't in med school where I wasn't doing that. And I felt better once I went back to it. And so that's the biggest piece of advice I have, is to not lose, even if it's just a few minutes every week, where you can sit and you can just focus on something that's not related to medicine. I think it's a very helpful thing, especially for mental health.